Welcome, everybody, and I want to start by thanking my friend and colleague, Secretary of Agriculture, Brooke Rollins, who you're about to hear from. Brooke understands that good food policy is good health policy and good farm policy. Our partnership represents an historic collaboration between HHS and USDA, one that finally aligns the prosperity of our agricultural system with the health of the American people. And when we were sitting backstage here, Brooke was talking about all of the great publicity that we've gotten on this announcement yesterday, which has been extraordinary. And she said, it's the first time I've had good publicity. I don't really know how to handle it psychologically. but it has been wonderful. The one voice against us has been the American Heart Association. And interestingly, Marty McCary wrote a book about the war on saturated fats. And I urge people to go and read that chapter to his book, which is called Blind Spots. It's an extraordinary saga, and it is kind of a template for how scientific consensus often orients around one bad study that then becomes the dogma. And that it's something that's really bad for you, and yet the scientific establishment, there's a big difference between established science and the scientific establishment. And the scientific, we all know that trusting the experts is not a feature of science. It's not a feature of democracy. It is a feature of tyranny and a feature of religion, but not science. In science, you question everything. And, we were told for 3 years during COVID, trust the experts, but that is not science. Science is eternal skepticism towards all orthodoxies, understanding that people in authority lie, and that there's all kinds of conflicts of interest that drive the creation of orthodoxies and dogmas around bad ideas. And that in a democracy, we have a responsibility to become the CEOs of our own health, to take charge of it. It's a big responsibility. It's a responsibility people maybe in other countries don't have. But it's something that is a burden that's put on each of us. And we all need to question what we're told. And this war on saturated fats is a really good example. And again, I urge people to read Marty's book, but one of the big villains in that chapter is the American Heart Association, which it was and continues to accept millions of dollars on the biggest processed food makers in this country, and then given us and supported and fortified a dogma that vilified and demonized good food and implicitly then bolstered the economics, the mercantile ambitions of the processed food makers that were providing its funding. And these are the conflicts of interest that all of us, Marty and Jay and Oz and everybody in this agency, came in to end those conflicts and to expose them. And it's important that the American people know that sometimes they're getting medical advice from people who have an economic stake in that advice. And we have a responsibility to question that. I'm also grateful for all the people attending today, including SBA Administrator Kelly Loeffler, National Advisor for Nutrition, Health, and Housing, Dr. Ben Carson, USDA Secretary of Agriculture, Stephen Faden, member of the Maha Caucus, Senator Ron Johnson, a huge advocate for us, and Chairman of the House Committee on Agriculture, Glenn Thompson, Senate Maha Caucus Chair, Senator Roger Marshall, another great friend and advocate, House Maha Caucus Chairs, Republican Lloyd Smucker, and Verd Buchanan, Chairman of the Republican Policy Committee, Representative Kevin Hearn, Chairman of the Republican Study Committee, Representative August Pfluger, Chairman of the House Appropriations Subcommittee on Agriculture, Andy Harris, and Representative Nick Langworth, and the many executives of the food companies and major associations who are here with us today. Today marks a revolutionary change in federal nutrition policy made possible by President Trump's leadership and the work of the MAHA moms and public health advocates who demanded reform. Today, we are here to celebrate the release of the Dietary Guidelines for Americans 2025 to 2030, the most significant reset of federal nutrition policy in history. The stakes are measurable and severe. The United States has the highest obesity and type 2 diabetes rate in the developed world. We spend 3 times more per capita than the European Union on health care, yet our life expectancy is 5 years shorter, largely due to diet-related chronic disease. Our childhood obesity rates are 5 times higher than obesity rates among children in France. 1/3 of U.S. teens have prediabetes. Over 30, when I was a kid, juvenile diabetes was practically unknown. A typical pediatrician would see 1 case over a 40 or 50-year career. Today, 1 out of every 3 children who walk through his office door is diabetic or pre-diabetic. 35% are overweight of our teens or obese. 20% of young adults have non-alcoholic fatty liver disease. 20%. 77% of military-age children cannot qualify for military service because of diet-related chronic disease. If a foreign adversary sought to destroy the health of our children, cripple our economy, weaken our national security, there would be no better strategy than addicting our nation to ultra-processed foods. It's shocking that our own government helped to drive the cataclysmic changes in our diet. Johns Hopkins analysis estimates that 48% of federal tax dollars now go to health care. The CDC reports that 90% of health care goes to chronic disease that is related to diet. That means that more than 40 cents of every dollar collected in taxes is going to treat diet-related chronic disease. If the United States reduced obesity and type 2 diabetes and heart disease and Alzheimer's to the level that the Japanese have achieved, we would save $600 billion a year, about 50% of Medicare's projected long-term deficit, or $5,000 per family per year. Current policy worsens the problems. 42 million Americans rely on the SNAP, where common purchases include sugary drinks, candy, and chips. 78% of SNAP recipients are enrolled in Medicaid, and 90% of Medicaid costs goes to chronic disease. These incentives, so we're giving the kids chronic disease in the first place and diabetes, and then we're paying for it at the back end in Medicaid. And we're hurting the poorest people in our country, the people who can least afford medical care. The damage is real and it's preventable. President Trump has ordered it to end. The dietary guidelines rest on 3 pillars: protein, healthy fats, vegetables and fruits, and whole grains. These guidelines replace the corporate-driven assumptions with common sense, gold standard scientific integrity. These new guidelines will revolutionize our nation's food culture and make America healthy again. For decades, Americans have grown sicker while healthcare costs have soared. The reason is clear. Our government has been lying to us to protect corporate profit-taking, telling us that these food-like substances were beneficial to our health. Federal policy promoted and subsidized highly processed foods and refined carbohydrates and turned a blind eye to the cataclysmic consequences. Today, the lies stop. The new guidelines recognize that whole, nutrient-dense food is the most effective path to better health and to lowering healthcare costs. Protein and healthy fats are essential today, and today we end the 65-year-old war on saturated fats. Diets rich in vegetables and fruit reduce the risk of disease much more effectively than medical interventions or pharmaceutical interventions. Whole grains outperform refined carbohydrates. Added sugar, especially sugar-sweetened beverages, drive metabolic disease epidemic in our country. And today, our government declares war on added sugar. Highly processed foods. Highly processed foods loaded with additives, added sugar, and excess salt damage health, and they should be avoided. As Secretary of Health and Human Services, my message is clear: eat real food. If it doesn't come from the ground or the water or the air, don't eat it. If it comes wrapped in a package that is clear that the whole thing is a package, don't eat it. Nothing matters more for health outcomes, economic productivity, military readiness, and fiscal stability. The first time the guidelines directly address ultra-processed food and set firm sugar limits in federal procurements, driving significant reduction in added sugar in school meals. I thank President Trump for his leadership and the partners committed to ensuring federal food dollars that support real food and better health. I also want to thank all the extraordinary scientists who I got to meet as a whole group for the first time this morning from the top universities around this country who worked day and night to make this report happen. They really made miracles happen in a record amount of time. The dietary guidelines shape dozens of federal feeding programs, including Head Start. These standards affect 45 million school lunches every day, meals for 1.3 million active duty service members, food served to 9 million veterans in VA hospitals. Today, and Head Start and a lot of other federally subsidized food programs. Today begins the work of aligning these programs with affordable, whole, nutrient-dense food. I'm working with Dr. J. Bhattacharya, Dr. Marty McCary, to fund and prioritize rigorous nutrition research at the NIH in collaboration with the FDA. I'm also working with my fellow cabinet secretaries across the government to deliver results. This administration is extending an open hand to any stakeholder who wants to work together and fix this problem. I want to thank the many health organizations, not the American Heart Association, but the American Medical Association, the American Academy of Pediatrics, which does not agree with me on a lot of issues. We're suing each other on other stuff. But on this issue, they agree. There's a consensus. And I want to thank them all for partnering with us on this effort. I also want to thank the entire USDA team led by Kaylee Bueller, Jennifer Tiller, and the HHS team led by Assistant Secretary of Health Dr. Brian Christine, Kyle Diamanis, Joe Proenza, Rachel Amaro, Dorothy Fink, and Michael Bose, who are all indispensable to these guidelines. And I also want to thank my deputy, Stephanie Spear, who worked day and night to make sure that this product got out. And Heidi Overton and Callie Means and a bunch of other people who gave their lives to this effort over the past 6 or 8 months.